Redwood Newsmakers is being brought to you by your local U.S. Cellular stores.
We're here again with Marty Coelho, Executive Director of College Advancement and the CR Foundation for College of the Redwoods. But today he is here in his volunteer capacity as a spokesperson for the Humboldt Walk to End Alzheimer's. Welcome, Marty.
Thanks, Russ.
Marty, one of the major aspects of advancing Alzheimer's disease research is legislation through state and national lawmakers. Are we looking at some critical Alzheimer's legislation facing us here in California?
Yes, actually a bill just passed in the state. It's SB 639 is just passed. It's going in front of Governor Newsom for signature. Essentially, Bill SB 639 requires Alzheimer's and dementia information within continuing medical education for primary care physicians, nursing practitioners, and physician assistants.
Well, we're hearing that most healthcare providers are not comfortable with Alzheimer's and dementia diagnosis and care.
No, unfortunately, they're not getting the training and residency to be able to deliver that type of information. So half of primary care physicians are now saying that they're not prepared for the Alzheimer's and dementia patients coming into their office. In fact, 40% of them are not comfortable even making an Alzheimer's or dementia diagnosis.
That's a lot.
It's huge. Well, this is scarier. A third of them don't even want to give out information on Alzheimer's and dementia. They don't have that sense of confidence. So what's happening is in residency, about a fourth of the doctors in residency get no training on dementia and Alzheimer's. A fourth. And of the 3/4 that do, 2/3 of them say it wasn't hardly anything. So essentially we're setting them up to fail. One of our friends, she just went in for her Medicare initial visit, age 65. Part of that is supposed to be a memory test. Takes about 5 minutes. Doctor says to her, "How's your memory?" She goes, "Good." And he goes, "Great." That was the end of it. There was no memory test. So our physicians aren't even being set up to succeed on the front end. Right.
Yeah. Well, would you say another area of emphasis for the Alzheimer's Association is encouraging people to, say, put plans into motion to manage their legal and financial and medical issues when a family member is diagnosed?
Yeah, I think these type of conversations about your own mortality, what you're going to do with your health care, your legal and financial issues if you were to get sick, are incredibly difficult conversations to have. Unfortunately, too many people are then put in a position where one of them gets diagnosed with dementia, and then you're supposed to have that conversation. So then they're paralyzed and they don't even know how to bring it up in that moment of crisis and start working through those series of questions. And then what do? Wait till the patient is further into the disease? So if we don't start doing this on the front end, we're essentially taking the patient who gets diagnosed with dementia completely out of a position to manage their own health care.
Well, how can people be a part of the movement to support Alzheimer's and dementia research and legislation?
I think the easiest way to get involved is to join the Humboldt Walk to End Alzheimer's.
Oh, that's coming up.
It's coming up on October 19th down at the Adorney Center. It's really our way of providing support to the 3,500 individuals that have been diagnosed with Alzheimer's in Humboldt and Del Norte counties.
Marty Coelho from the Humboldt Walk to End Alzheimer's. Thanks, Marty, for dropping by.
Thanks, Ross.